The name of our region is a scapular region. So let's start with the boundaries. We have upper, the lower, the medial, and the lateral one borders. So let's draw them. To draw the upper border, we will need the acromioclavicular joint because we use it as a pointer. So crossing this joint, it should be a horizontal line going perpendicularly to the vertebral column, and it will be an upper border of the scapular region. So let's draw it like this. Yeah, this is an upper border. So the lower border, it's also a horizontal line that goes perpendicularly to the vertebral column, and it crosses the lower edge of the scapula. The medial one is a line that goes along the inner edge of the scapula. This is inner edge, and this should be medial border. The lateral one starts from the outer edge of the acromion, and it should be going parallelly to the vertebral column, but here can be illustrated, so it's fixed, it's connected here. So this is a scapular region. So let's begin. Let's make another one. Let's start with the layer structures. This one. Let's start with the skin. The skin of the scapular region is thick, it's inactive, and can be hardly be folded. And sometimes men have skin covered with the hair. And when the skin is contaminated in areas of friction with clothing, in elderly and exhausted people and in patients with diabetes mellitus, the furunculosis may appear here. And the many sebaceous glands, especially in our big. Yeah. So the many sebaceous glands in the skin, and when they are blocked in this area, the sebaceous cyst often appears or atheromas that require surgical removal. So let's remove our skin. Underneath the skin, we can see the subcutaneous fatty tissue. The subcutaneous fatty tissue of the scapular region is singular, dense, cellular due to connective tissue partitions extending from the skin into the depth into its own fascia. So um, it's not illustrated here, but still. Let's remove our subcutaneous fatty tissue, and here it should be superficial fascia. The superficial fascia of the scapular region can be represented by several sheets of varying density. They are particularly known superficial formations, subcutaneous nerves and branches of the axillary and supraclavicular nerves. So let's move on to the ulnar fascia. The ulnar fascia of the superficial muscles, the scapular region, the trapezius, the deltoid, the latissimus dorsi muscles, they form cases for them. So the fascia supraspinata and infraspinata, the ulnar fascia of deep muscles of the scapula. So this starts from its posterior surface. So this is superficial fascia of the deltoid muscle. Let's remove it, and here we will see the profound fascia of the deltoid muscle. Let's remove it. This is deltoid muscle. This is the trapezius muscles fascia. Let's remove it. This is latissimus dorsi fascia. This is latissimus dorsi. And here we can see the inner muscles of the scapular region. This is rhomboid major, still. This is rhomboid minor. This is infraspinatus. This is supraspinatus. Now this is teres major. This is teres minor. So this is scapula on its own. Let's take it off. And here it will be the subscapular muscle. Supraspinal space. The supraspinal space is located underneath the trapezius muscle. So let's check it out. This is a supraspinal space of the scapular region. It corresponds to the fossa supraspinata. So this is supraspinatus muscle. Let's take it out. Also, I should mention that it's covered by its own fascia. The fossa supraspinata, this formation, it's a part of the scapula. So it's the supraspinatal space at the top. It's closed as a result of attachment of fascia supraspinata to the upper edge of the scapula and to the facial sheath of the subclavian muscle. This one, facial sheath of the subclavian muscle, and to the acromioclavicular ligament. So here it should be a fascia, and it's enclosed the supraspinatal space at the top, and at the bottom it's enclosed by this by the scapula on its own. And outside of the base of the acromion and under the acromioclavicular joint, the supraspinatal space is open into the infraspinatus and subdeltoid cellular spaces. Here, this is the head of the humerus. This is the scapula, and this is clavicle. And the contents of the supraspinatal space is supraspinatus muscle, its own, on its own, this one, and veins and nerves of suprascapulars, this one's. This vein and artery, they lay in this area. Next one is infraspinatus ossifibrous space, and it's formed by the hypophagia of the scapular bone and the scapular spine. And its fascia is fused with the medial edge of the scapula, scapular spine, and lateral edge of the scapula. The contents of the infraspinatal space are the infraspinatus muscle, teres minor, small layer of fiber located between the muscles and bone, as well as blood vessels and nerves. This space includes the branches of the dorsal artery of the scapula. It goes along the middle edge of the scapula and underneath the infraspinatus muscle. It also the suprascapular artery. There's some branches and also some branches of the circumflex artery. All perforates the fascia. They make anastomosis using infraspinatus tissue in the thickness of the infraspinatus muscle. And as a result, the scapular artery, scapular arterial collateral circle is formed. And if blood flows through the main axillary artery is obstructed or stopped above, where the scapular artery originates from it, the blood circulation of the entire upper limb can be maintained due to anastomosis of the scapular circle. And also in this area, we can see some muscles. There is a teres minor muscle, teres major muscle, or triceps. We will take a deep look at its long head because the teres major muscle, it begins from the lower edge of the scapula and its upper edge is adjacent for lower edge of the teres minor, covered by the infraspinatus fascia. And here it is a gap in between them, and the long head of the triceps crosses it, and it divides it into two gaps. The first one is trilateral gap, and the second one is quadrilateral gap. The edges of the trilateral foramen from side of the scapula are from below the teres major muscle, from above the teres minor muscle. And from the lateral side, it's a tendon of the long head of the triceps muscle. This hole, some arteries passes into the scapular region from the axilla. Next is this of the facial teeth of the teres major muscle, like this little part. The quadrilateral foramen, this one, it's actually it's located outside of the scapular region. Also, here we can see suprascapular artery, a nerve projected along the line. So let me draw it. They're projected along the line running from the middle of the clavicle, to the point corresponding to the base of the cranium, So they are projected in here. There is a border of the outer middle third of the spine of the scapula, and also from the medial side, along the middle edge of the scapula, we can see this is a dorsal scapular artery. It runs on the inner edge of the scapula in distance of 0.51 millimeter medially from this edge. And the entry point of circumflex scapular artery runs into infraspinatus bed. It is projected to the middle of the projection of the lateral edge of the scapula.